this presentation.
That's kind of a low blow.
That's the quickest one you've ever had.
I don't know if you've all heard this before, but the docket system, the docket system, I just want the change. John was not here, I guess. Each resolution and motion is put on the docket, and the paper is passed around at the committee meeting to sign each one. I'm proposing to have a master docket for each committee meeting, and which lists every resolution and motion with a vote. You'll take the vote individually, as you always have done. Instead of signing each of the dockets, you'll all be asked to sign the one master docket, which states at the end that the resolutions and motions listed on the above docket have been separately considered and voted on. All resolutions, except those specifically rejected by the committee, are hereby forwarded to the board for action. Okay? So I'm asking the committee for if you'd make a motion and vote on that process. John? Second by Andrea.
Anybody got any comments?
Somebody have any?
Anybody? Good enough?
Vote?
Vote. All in favor?
Aye.
Ready to go.
Okay, thank you very much.
Okay,
You ready?
ready for me?
You betcha.
Okay. So I'm here to talk to you today about our community health assessment and community health improvement planning process, since we are going through that currently. And now is the time for you guys to listen to this and have your input heard if you so wish. So the background on our community health assessment, every 6 years the New York State Department of Health develops what they call the prevention agenda. This is their state health improvement plan. So they perform a health assessment just as we do locally. They look at all of the data, they identify trends, they identify priority areas, different measures that they will be using to track those over the next 6 years. And then they also do us a favor at the local level and do all of the research for evidence-based practices that we can start here locally to impact these priority areas. Their focus for 2019 to 2024 is health in all policies and healthy aging. They want to be the first age-friendly state. I think I said that correctly. Sorry if I didn't. So on the local level, counties perform a community health assessment and a community health improvement plan every 3 years. In other counties, they do this in collaboration with their local hospitals. Our hospital, being a county-run hospital, is not required to do this. However, they do play a part in our plan. So we develop strategies based on our health assessment, and we work to advance the statewide goals. So the state has given us the priority areas that we need to pick from. And then we also need to address the health disparity within the work that we do, which in the past has typically been poverty. So the purpose of the overall health assessment is to understand the general health of our community, assess what causes and risk factors we have for disease locally, evaluate the effectiveness of current programs and policies that we have in place, what's working and what can we improve, and then planning for allocation of resources and efforts going forward for the next 3 years. So I'm going to give you some overall information that is included in the current community health assessment that was just completed It's still in draft format, in August. And counties right now are working through the draft and trying to add more data and answer all of the, unanswered questions within that. And it is due to the state at the end of December. So in the 2018 US Census estimate, our population was estimated at about 26,000 people, which is down slightly. 96% white, not Hispanic, so we are not very diverse. 50% male, 50% female.
Depends on how far back you are.
Are we sure about that one?
And our median age is 41.8, which is slightly older than us compared to the region. When I say region, I'm considering Lewis, Jefferson, and St. Lawrence County, but we're right on target with the rest of the state. Employment, income, and poverty. Our unemployment rate is 5.5%. This is lower than the previous year. This is 2018 data, but higher than the statewide average. Our median household income is $51.8 thousand. This is lower than both the national and statewide value. Our poverty rate is 13%, and that is 2017 data. This is lower than the region and statewide rate. 90% of our population have at least a high school diploma or equivalent. 16% have a bachelor's degree, and I didn't put this on here, but I thought it was important. 44% have at least some college, and 7% have graduated from a professional degree, or have a graduate or professional degree. So I'll go into some of the health data. These are the leading causes of death that were identified in our 2019 Community Health Assessment. So you can see here that heart disease has trended downward and cancer has trended slightly downward. Our most prevalent cancers are colon and lung. Respiratory illness in blue has remained fairly steady. The one thing I do want to point out here is that our causes, external causes of death have increased steadily since 2014. And those are due to our overdose, suicide, and transportation accidents.
Farm accidents, logging accidents.
Yeah, they could be.
Talked about that.
Yep.
What's that number up
I wanted to talk a little bit about suicide in particular. Our suicide rate has increased over the past several years. The 3-year rolling average is 20.6 deaths. This is more than twice the statewide average. Now we are small in numbers, so that does tend to make us look worse, but still a very important issue to consider. Obesity. Our obesity rates are down slightly. 28% of our adults are obese. When you include overweight, that's 67% of our adults. 20% of the children are obese, and again, when you include overweight category, that's up to 39%. These are all above the statewide average. I have up on the slide here a summary of the sheet that you have in front of you. So the sheet that you have in front of you are all of the health indicators that the prevention agenda looks at. The first column of numbers is the prevention agenda objectives, so that's the goal that they want us to be at. The second column of numbers is our current data for Lewis County. I then, in the third column, compared it to where we were with the last community health assessment. In the next column, compared to the rest of the region. And then in the last column, down there compared to New York State. So the color coding, all of the green are meeting the prevention agenda objective. So we are doing well and we're meeting their goal. The yellow or orange color, we're not meeting their current objective, but we're doing better than the rest of the state. And in red, we're not meeting the objective and we're doing worse than the statewide average. So a couple of things that I wanted to point out because I'll be talking about them later. Under women, infants, and children, infants that are exclusively breastfed in the hospital, we're doing very well with that. We have 66.7 who initiate breastfeeding. However, when we look at 6 months, if they're still breastfeeding, we drop to 19%. So that's far worse than the statewide average, which is 30%. And breastfed babies, it helps with obesity along with many other health issues. So in other meetings that we've had with community partners, this was brought up as a potential area for us to work on. And then also under the women, infants, and children with untreated tooth decay, we have 51.4% of our third graders who have untreated tooth decay. So that's significantly above the statewide average of 24%. So that was another area that we have worked on in the past. It hasn't been part of our community health improvement plan, but we are sitting on a regional group that is working on that, and at times when it's a priority for the rest of the counties in the region, sometimes money can be allocated to certain areas to help with those. And we do have some ideas on how to help fix those.
We talked about the big F word that we weren't supposed to say, fluoride.
Yep.
But not a single one of our village municipal water systems add fluoride to the water.
Correct. We have 2
Not
naturally
a coincidence
occurring.
that we are doing poorly on children.
Correct.
You have two
Was-
what? You said
We have
naturally
2
occurring.
naturally occurring, one in Seaville and one in Casterland. So in their municipal water, they have naturally occurring fluoride.
Guess we cut that one program several years ago, we cut the program with, what was it, going into the schools, toothbrushes and,
Oh, Mary Fran.
yeah. Yeah, that was a program where you went into the schools and worked with the kids.
Provided education.
Educational for brushing the teeth. I think it was like, he saved what, $5,000 or something.
Right.
It was ridiculous.
It was a good program.
And I'd have to look into that too to see if it's evidence-based. All that we include in this needs to be evidence-based or a promising practice. So there needs to be science behind it to show that it works to improve the health outcome.
Well, do you have earlier data than this?
Oh yeah.
When she was doing the program versus now she's not doing the program?
The state determines what's evidence-based and what's not.
Correct. We don't provide local data. We can show local impact of something. So after we looked at all of these health indicators along with the rest of the community health assessment document and data, we worked with community partners to develop our community health improvement plan, which we're still in the process of. So for the last 3 years, our plan focused on obesity and suicide. And all of our work towards improving these health outcomes will take years to show change. It's not something we're going to change overnight. So during this process, we evaluate past interventions. We look at where we've had success. We will build upon that success. We will look for new evidence-based interventions to bring to the community to have further impact. We will choose programs that fit Lewis County specifically. and also provide the highest level of impact. So I'm gonna show you this pyramid, and it's the pyramid of health impact. We wanna do things that are at the bottom of the pyramid, so things that affect the entire population. Policies that make the healthy choice, you know, pretty much the only choice. Or different programs that allow citizens to live a healthy life. And that's where that health in all policies comes into play. And most importantly, we work with community partners. We cannot do this work alone, so we need to have buy-in from all of our partners. So the tentative priority areas, you have this document here that you can semi-follow along with. Over on this side are the overarching priority areas, which I will have at the top of the slide. And then they have focus areas, which will be the underneath there. So under prevent chronic disease, we actually chose 3 focus areas. And like I said, these are tentative. The first one, addressing obesity, is physical activity. And we would like to work on complete streets. The Tug Hill Commission has worked on this locally. They've had some success with Lions Falls, Copenhagen, and Lowville doing walk audits. And some work has been done with what those walk audits showed, and these municipalities have been given draft complete streets policies. Also comprehensive school physical activity programs. That's something that we have been working on for the last 3 years. We've had good success with 4 of our 5 schools committed to implementing this program, where all children K through 12 get at least 60 minutes of physical activity every day. They are committed. They've been through initial training. They have more training coming tomorrow for physical activity, specifically in the classroom. So we will help the schools to fully implement this program over the next 3 years.
How does that actually work? 100 minutes, you said?
60.
Oh, 60 minutes.
Yes.
That's a period and a half. They're 40-minute periods, I think, for the students.
Yep, but it's not just
It's not
60
just-
minutes straight of physical activity. It's incorporating it
Changing
into
classes, all that stuff counts?
Yep,
Okay.
all of the activity that they would get throughout the day,
Mhm.
ensuring that all children K through 12 get at least 60.
Okay.
Ashley, can you spend a little more time on complete streets, because that's something that if it does get included in this, ultimate plan, you're gonna need the board's support on to implement. That's not something that just the public health department can do.
Correct.
So maybe you can explain a little bit more about what that is and why we'll need board support for that.
So, complete streets is a policy level decision. So that can either be at the town or village level or a countywide policy. And this is so that when a new road comes in or a new business comes in, there are certain standards that they would have to abide by in order to put that road down or to have that business come in. And ultimately, it's going to have a better impact not only on health but also our economy. It's making communities more livable, walkable, more attractive to people, making it someplace where they want to go and live healthy lives.
So in a rural community, the villages are where you think of this the most, because it's talking about, making sure that all streets have sidewalks, that there's bike lanes available. A complete street means that it's a street that's not just built for automobiles, it's built
Correct.
for all types of transportation, and in that way you're promoting healthy living. But from our level, we could see, working with the highway department next time we repave a road to add a bike shoulder or something like that. Try to do some things through our infrastructure development that promote a more healthy lifestyle.
And it doesn't need to be, I mean, there's lots of small things that you can do too. Mark Fenton, who is the national speaker in regard to this, does a wonderful job with the walk audits and getting municipalities to really think about little things that they can do to make a community more walkable or livable. Just connecting two sidewalks that end where, you know, people have to walk in the road and that might prevent them from walking to school. That little step could make a huge impact. Did you want anything else on that, Ryan? Okay. The next is nutrition, again, addressing obesity. Assessing for food security. This was brought up in our discussions with community partners. We did find an evidence-based practice in which providers, when they're seeing a patient, can, you know, have a conversation. Do you find it difficult to give healthy food? So just assessing for that, and then if appropriate, making a referral to the food pantry or WIC or SNAP, so that all individuals can have access to healthy food. Also under prevent chronic disease, preventative care. So we are currently working with the providers' offices to incorporate a screening for prediabetes into their electronic medical record. So when when a person is pre-diabetic, whether that's by blood glucose or just answering the lifestyle questions, they would be referred to our diabetes prevention program if they agree. That is an evidence-based program that's had great success. We had individuals lose 725 pounds in Lewis County last year with that. The next is utilizing information technology, so making that referral automatic from the electronic medical record to a platform that we would have at public health or other community agencies that are providing these evidence-based programs to make things easier for the doctors. Also increasing referrals to our evidence-based programs. Public health, Office for the Aging, and NERCL currently provide evidence-based programs to our residents to help them with disease management and to live healthier lifestyles. And increasing access. So I particularly wanted to include this one because this is also in line with our strategic plan, trying to meet people where they're at. So if we can provide a class online, then people don't have to travel to a class. Doing that, or also taking the class to where they are. So if we have a group of residents in Port Lyden that need the class, traveling to them. The next priority area, healthy women, infants, and children. Like I said, breastfeeding was identified as a local priority by community partners, and we currently have the North Country Prenatal Perinatal Council who is doing home visiting for postpartum women and providing this support. So our role in this would be just increasing knowledge of this resource within the community and making sure that moms are fully utilizing it. The next initiative would be workplace support. So it is currently law that employers need to provide a place for women to be able to breastfeed their infants while they return to work. We believe that this is a huge barrier for the ongoing to 6 months. So making sure that employers are aware of this law and helping them in whatever we can do to get them to abide by the law. And I've talked about reducing dental caries, so we would increase the delivery of fluoride varnish treatment in the doctor's office. Jefferson County has had great success with this. We tried to do this a couple of years ago before providers were doing this on a regular basis. The billing was unclear, so we couldn't really get to the buy-in from the providers, rightfully so, but the kinks have been worked out, and like I said, Jefferson County has had great success with their providers doing this. And this is a way that all children would get the fluoride varnish treatment, the ones that are seeing the doctor anyway, which they're seeing the doctor more than they're going to see the dentist. And this would be earlier, and it would be more often.
So is it just a mouthwash or how do they?
It's a paint. They paint it on what teeth they have. And the final priority area, prevent mental and substance use disorders is the overall priority area. We picked specifically suicide prevention, and we have 3 interventions under this that we are considering. The first is zero suicide. So that's really a system level change, and it's something that we need to talk with more community partners about to see if that's even going to be feasible. Like I said earlier, we do stuff that will fit Lewis County, so I want to make sure this is feasible for community partners to implement before we say we're going to do it. But we're thinking about it. It's a system-wide culture committed to identifying individuals at risk for suicide, getting them a care plan, abiding by that, following through, training staff, having easy and warm handoffs through the continuum of care. So really just better serving all of our patients and clients. The second is postvention. We're already doing this. We will continue to do this. This is our community crisis response team. And the final is promote connectedness, coping, and problem-solving skills. So Bridges Out of Poverty falls under this. And NERCL, if you'll remember, received innovation funds to start this. And we will be starting getting ahead classes out of this. And those classes will certainly have an impact on that last intervention there. Does anybody have any questions on any of that? Or anything that you would like to see added, changed, considered?
What do you think the program runs?
Fluoridating the water, or
With the thing like that?
it's a billable
Oh, it is a billable
service, yes, so they can bill insurance for it, and Medicaid covers it as well.
Talking about the fluoride.
Yeah.
Yep.
Yeah, I think, as Greg indicated, I think that's important. If we could support that, somehow that would be. I don't know how much interaction public health has with the schools, if you could, I don't know if you can, what you can do, I guess.
So the purpose of the fluoride varnish treatment is really to catch children early. So you're catching them when their teeth are just coming in. So by the time they get to school, they already have a full mouth of teeth. So the fluoride varnish treatment is actually, it's evidence-based. It's, providing more of an impact. Teaching them to brush their teeth, yes, is very important. But a lot of times damage could be done by the time we would get to them. And I'm not exactly sure what age groups she taught that to.
I think
Elementary up to what, 3rd or 4th?
Yeah, 3rd or 4th period, yeah.
Okay.
To your point, damage has probably already been done by the time you get there.
A lot of times, which is, I think, why that's not evidence-based. I will have to check on that, and why the fluoride varnish is
And
evidence-based.
you're looking at permanent teeth, not the baby teeth.
No, these are baby
both.
teeth, and then both as they age, and we continue to provide that fluoride varnish treatment.
Actually, talk about just a little bit that this decision was not, these ideas were not just siloed from your department. You have been out and about meeting with community groups. Talk a little bit about that. process of selecting the focus areas?
So we primarily have used the priorities council to, number one, review the community health assessment and identify areas not only where the data is showing that we're doing bad, but where community partners are thinking that we have a gap within our county and we need to fill it as public health because there's nobody else doing it. And we certainly don't want to duplicate services. We want to build upon success and fill in where the gaps are needed. So our community partners have had input right from the start, along with giving them the selection of all of the different interventions and kind of choosing which ones. Now, our next step is, number one, to reach out to the partners that we think are going to hold a significant role in this and ensuring that they are on board and this is what they want to work towards. Number two, kind of figuring out the logistics of who's going to do what, identifying measures, because we always need to show that we're having an impact on something. So we can't just do it if we can't measure it. So we have another meeting in November that will be diving deeper. And partners have had the opportunity all along to say, no, I don't think we should do that, that's not going to work, or give us different ideas. Again, keeping in mind with the prevention agenda and what we have to work with.
What were some of the other priority areas that weren't chosen per se?
So one of the priority areas was prevent communicable diseases. So number one, for the majority of them, we're doing very well. It's under infectious diseases on this one that you have, and you can see that a lot of them are green. We also do this in other departments within public health. So I don't want this plan just to be repeating everything that we already do. I want this to be work that we're doing above and beyond on a population health level to make a larger impact on the health. Another was promoting a health and safe environment. A lot of this complete streets would take care of. Some of it is environmental health focused, and we are only a partial service health department, so that's not something that's our expertise. Certainly our state health department, the district office is working on this stuff, but it was not thought that these were high priority areas. Anything else in particular?
Thank you.
Welcome.
Anybody else got questions for him?
And once the health assessment is finalized, I'll be happy to share all of the data with you. Anybody else see this? Okay.
The first docket is authorizing addendum agreement through Office for Aging and Open Sky to allow the certified nutrition specialist to use the county vehicles for visits to congregate meal sites or individual homes to provide consulting services upon proper documentation of the driver's license and insurance, and agree to abide by all policies, rules, and regulations pertaining to use of county vehicles.
Is Open Sky, are those in county employees?
No,
And what is the insurance that they'd be,
they would have to provide us with an insurance,
don't we insure the vehicle?
we insure the vehicle, but they're a contractor,
Mhm.
so they would have to provide us an
Like a liability insurance?
Yes, they would have to show us, they
Yeah.
have proper insurance.
We don't do this often, Dick. In fact, I think this might be the only contractor that we are giving access to our county vehicles or proposing giving access to. The reason is that, it prevents us from doing mileage claim.
Right.
So it's just cheaper for us to let them use our vehicle than to pay mileage,
Mhm.
so.
Mhm. All the questions I
So we need to vote.
Vote. All in favor?
have. Sure.
Aye.
To appropriate funds within the community services accounts for purchase of 2 computers, $1,172.03.
Are these noted somewhere else? What,
What's that,
are
Dick?
these new?
They're
Yeah.
for her new program, right?
For what?
Her new program.
That's for the new grant that we're working with, Columbia University. So this
Okay.
particular money, this, federal salary sharing, we don't appropriate that. We only appropriate it when it's needed because it can only be used for very specific things. So, that's why we're taking it out of that account rather than Pat's operating budget, because we rarely get to use this money, so we might as well use it.
Okay, so that's coming out of like a loan thing or grant account or something?
Yes.
Okay, thank you.
All in favor?
Yes.
Aye.
To amend and adopt doing business as designation formerly known as Lewis County General Hospital and Residential Healthcare Facility to be designated as Lewis County Health System. This action is approved with the knowledge it shall not impact tax or other legal designations, which shall remain under the name of Lewis County General Hospital.
Anybody got questions? All in favor?
I got a question, I guess, the county general hospital and residential, isn't it residential
Care facility.
care facility or something, should that be there as well?
The formal
I
name.
used whatever language was
I know
provided to
you
me.
did.
I guess repeat your question.
It's residential healthcare facility, I think,
Residential.
rather
healthcare.
than just the word residential, that's the only thing I thought, to make that complete.
It's in the title,
It's the
Dick,
one
it's
on-
the
And
Yes.
residential healthcare facility.
Right.
Okay, yes, it's right there, yes.
Section 2.
Mhm.
Oh, I think your
Formerly
cover
known
sheet
as
is
Lewis County General
different
Hospital
than the
and
actual
residential.
resolution.
Oh, okay.
The resolution has it correct.
Has it, okay.
Yeah.
Good.
Okay. All in favor? Aye. Passes.
Authorizing renewal agreements between Office for Aging and the various providers for short-term services for 2020. You want me to read those?
No, I think everybody can read.
Okay.
You can all read, right?
Today.
Maybe.
I'm getting there, Greg.
The only thing is, Kelly, is that $9.28 per meal, is that a raise of like 50 cents?
Yeah, that's for going into the new year. That's for Teresa and for Fred.
Okay. Thank you.
And I don't have to increase the line. We have the money to accommodate already in the budget for that increase. Just throwing that out there.
Okay, all in favor?
Aye.
Passes.
Authorizing the agreement between Office for the Aging and Volunteer Transportation Center of Jefferson County to provide services to certain elderly residents from 20 to 21 at a cost of $875 per month.
Any other questions? No questions. Any questions, sir?
No.
Everybody in favor?
Aye.
Aye. Opposed? Okay, pass.
Authorizing a Phase 4 project addendum and Appendix 1 agreement through Public Health and Central New York Collaborative, outlined under the project addendum and Appendix 1 and value-based payment readiness and performance activities to be completed between July 2019 and December of 2020. in order for public health to receive up to $4,000 in payments under the project addendum and appendix 1.
Any questions? All in favor?
Yep.
Aye.
To transfer funds in social services accounts to cover supplies and education line item expenses up to $9,500.
So this is a Ryan Pichet special because Jenny requested that these line items be bumped up in the budget, and I whacked them down last year, and turns out she needed them after all. So we're just taking this money from money we have left over in personnel services because we've had turnover and vacancies and such, and using it down for supplies and education.
Ryan, that's actually a typo. It's not supplies.
It's training.
It's travel, subsistence, and then education training. Two different accounts.
So she requested in the budget, and I said, "No, you'll be fine."
So did you kick it down again this year?
No, we put it up this year.
Learned his lesson.
Next year.
Okay. Anybody got questions?
Nope.
Everybody in favor?
Authorizing renewal agreements between DSS and various providers for program services for 2020.
Anybody got questions? Everybody in favor?
To authorize 2020 renewal agreements between DSS and the Law Department for abuse, neglect cases, collection recovery, and child support services.
No questions?
All the renewals.
All in favor?
Aye.
That's not how every county does it, by the way. We contract with our law department in-house. Many other counties have lawyers that work right through the commissioner, right as a DSS employee. So there's different ways to go about it. That's just works for us because we're small.
Authorizing renewal agreements between the community services and various providers for program services in 2020.
I'd like to get updates from some of these, like Mountain View, Credo. We don't hear anything from them. We're putting a lot of money in these programs.
Well, Merkel was just here.
Yep, they were. They did a
Mountain
good
View
job.
and Credo. We talked about that, getting them in for a presentation as well. So Mountain View, Credo, and TLS came last year, but
No, I mean, you hear a lot of stuff about Mountain View, how they're going bankrupt, and Credo just has never impressed me in 2 years I've been here, so.
yeah, I think that's a good thing to get on the agenda. Have them come in and review what they're up to.
Can you do that, Pat?
I sure can.
Okay. Thank you. So we just double, any more questions?
Nope.
You good with the numbers? Are these up significantly?
Not really, no.
Just a few percent?
Yeah, not even, in fact, a little bit, just like a couple dollars, not much.
Thanks, Pat. Okay. All in favor?
Aye.
Agreement between community services and Fort Drum Regional Health Planning Organization to conduct health community study project activities from October 19 to September of 2020 for an amount of $190,008.
So we were talking earlier about, this is grant funded, I
This is
think.
part of the Columbia University grant funding.
Okay. Wait, is that true? It's from Columbia?
Well, they're
No.
managing, Columbia University is managing.
Yeah.
The money comes from NIDA.
Yes.
From where, Pat?
NIDA, no, please don't tell me, ask me what it is.
No, that's fine, just
Alright, good.
an agency that gives us
It's
money.
federal agency.
Okay, good. Thank you.
All in favor?
We've got to withdraw this one. Here.
If I could speak for just a minute, I'd like to withdraw this one, but I'd also like to make a motion that we advertise for interested people who'd like to serve on that hospital
Sam.
board member. Pardon?
Sam wasn't interested in that?
He was real interested, and about 10:01 today, I got a call that said he changed his mind due to personal reasons.
Oh, okay. That's too bad. Sam had a good time.
I think he was afraid of the time commitment, I'm
Time
not
commitment,
sure.
yeah. Cutting his golf game.
Yeah, he plays golf on Monday. So, if we could do that, do we have to wait for the November 5th, or can?
No, we can advertise, wants to advertise a position.
We gotta advertise, at the last meeting we did a couple positions, planning board and ag protection board, so we'll put them all out.
Okay, yeah, we just need to advertise it. Yep, thank you.
Authorized reclassification of office manager and DSS as a result of agreements.
So this goes to the grievance settlement that we talked about last month.
I don't see that on here.
It's not.
It wasn't in the packet.
No, nope, got it here.
Okay.
Where?
So, we can get it to you guys to review if you'd like. I didn't realize it didn't make it.
Got
to
the
the packet.
Oh, that,
resolution.
yes, she filed it, so, did we, what ended up happening with that agreement?
We settled on it,
Settled
yeah,
for,
the reallocated position, and we decided on a January 1
January 1 this year.
2019.
Yeah, right.
retro, yep, not back to
Retro.
the initial requests. That's what they started with April of
16.
2016 they wanted.
Right, right.
And we worked our way through the.
I've got no problem with this, been discussed before.
So you wanna vote on it?
Yeah, you all in favor?
Sure.
Aye.
Good.
That is all the
Okay.
docket. I have two motions. One, to authorize Jenny Jones to refill a community services worker effective immediately.
What, community service worker?
Community services
I
worker.
thought community services was Pat.
Well, it's just the civil service title for that position is called community service worker. It's kind of the lowest title we have at DSS. The current person in the position wants to move to the temporary office specialist and only work 6 months out of the year. She just had a baby and she wants her summers off, so it's leaving a permanent vacancy for her old title.
So this is refilling a position.
Just
that's in the
refilling a
budget already.
position that already exists, already in the budget.
You absolutely need that position.
I would say yes.
Any questions? No. Any questions?
How long has she been without that position?
She hasn't been without it.
Oh,
I'm sorry,
This
what was the
community,
question?
she just said, this community
How
service
long have you
worker
been without the position?
is
It's
going over to the
currently
office
filled.
specialist, it's a temporary 6-month position. So she has to refill this, refill the position, right? I got that
I didn't
right?
hear all that.
It's a refill.
It's a refill of someone that,
Yeah.
she's currently in the position, she's gonna move to the temp position
Yeah.
at the end of this month.
Temporary, but every year she's gonna get that temp,
That would be correct.
or she's gonna want that.
She'll, yep,
That's what she's gonna be offered, I mean,
Right.
she can't bump this other one back,
no,
yeah.
nope, there's no bumping back.
Okay, everybody got any other? Okay, let's have a vote then. All in favor?
Aye.
All good.
And a motion to authorize, Director of Office for Aging to refill, no, I'm sorry.
Refill.
Yeah,
I'm sorry.
refill the director.
Yeah.
Okay, I
Because we
totally
fired her.
wiped out here. Let's start that over. Motion to authorize refilling the Director of Office for the Aging effective immediately due to resignation.
Oh, that was incorrectly worded. We fired her. Put that on that
Oh,
resume.
fine.
Can't force it. Okay, make that motion, everybody okay with that?
With reluctance.
We gotta do her. That's it.
I'd like to make one other motion if I could, please.
Sure.
I think somehow this board needs to put a commemoration or a thank you or something to the current director that's in that position, thanking her for the job that she's done for us. 'Cause I think she's done an outstanding
But you gotta, what about trying to?
The vote.
Did we give
I
them?
think it does.
Yes, we did.
Okay. Make sure.
Yep.
On the summer docket. That's the big X.
So you can't put it in there, that's just fire then.
Huh?
You can't put it in there, that's just fire then.
On the bottom of the flag. Oh, God.
So if we list that position, the OFA position, you know, within the week, we'll put 2-3 weeks on it for people to respond. So that'll bring us to pretty close to the next committee meeting. It'll be about a month anyhow. So why don't we plan on reviewing resumes at the next committee meeting and then setting interview dates after that? Does that work?
That works for me.
Perfect.
You have a plan for somebody to cover that?
Kelly's gonna be here until the end, the 11th, yeah, I forget, the 11th, yeah.
That week.
Yep,
Yes,
that week.
so if I need to extend the rest of the week, I can.
Oh, okay, great.
Well, you know, this is not the first time that we've gone through this intentionally, so, I'll start checking in on them more regularly, and it's actually good now that they're in a building with Jenny and Pat, because they can, check in.
But I would like the opportunity to kind of throw out my opinion for requirements for the next director.
We can't hear you.
Yeah.
I would like an opportunity to kind of throw out my opinions for requirements for the next director, just kind of qualities that you guys could be looking for.
Can you put that together?
Fine with me.
I sure can.
Thank you.
Absolutely.
Put your name in that one.
What she wanted. I know she did.
Well, that's the same. What if I voted no on it?
If anybody votes no, that would be recorded right there on the individual see how they're listed? Yays,
Yeah.
any
So I gotta
nays,
vote nay so I can see how it works.
and a nay would be recorded. Anywhere you voted.
And that would be the person's name
Absolutely.
versus.
Legislator, it would go, it would record who exactly voted against.
Okay, gotcha.
Each of the